Will Today I'm going to talk about assessing a person who's experienced a mental health crisis. Sometimes a patient will experience a mental health crisis in the community that requires them to be transported to either an emergency department or a mental health unit. It's very hard to treat a person experiencing an acute mental health crisis, particularly in the pre-hospital setting. Often transportation to appropriate destination is required, but to be able to do this, we must be able to gain the patient's consent. A competent patient has the right to refuse any treatment offered to them. The assessment of a patient experiencing a mental health crisis can be very challenging. According to St. John Clinical Procedures and Guidelines, a patient may not be competent if they appear to be unable to understand information or appear unable to understand the consequences of their decisions or appears unable to remember information or has attempted suicide or has expressed serious thoughts of attempting suicide. If the patient is deemed to be not competent, we are able to provide treatment against their will if the treatment is in the best interest of the patient and the risks involved with giving the treatment are less than the risks of not providing any treatment at all. Also, the treatment is not contradicting a valid advance directive. Often patients will agree to treatment and admission voluntarily, but more often than not, patients will refuse treatment, putting themselves and others at risk, and they will not give consent. There are specific guidelines for involuntary treatment which include the person appears to have a mental illness and immediate treatment is required, and the person presents a risk or harm to self and others, and the person requires admission to a mental health facility for treatment. The Mental State Assessment, or MSE, is a useful tool used to assess the state of a patient's mind. This assessment focuses on the patient's mental state. It is important for the paramedic to also get any information about the patient's appearance, their living environment, their cleanliness, and their sleeping pattern. It begins with their appearance. What do you see? So that includes their posture, the clothing that they're wearing. Is it clean? Is it dirty? Their living conditions. Are they clean or dirty? Their physical condition, their facial expressions. Then their behaviour. Do they make eye contact? Do they maintain that eye contact with you? And activity. Are they pacing around the room, wringing their hands? Do they appear agitated or appear disorganised? Their speech, when they're speaking, is it slow? Is it fast? The volume, are they talking loud or very quietly or mumbling? Their tone, and are they coherent? Mood is the patient's emotional state. When you ask them to describe how they're feeling, are they using words like fantastic, elated, depressed, anxious, sad, angry, or irritable? Affect. This is how we observe the patient. The patient may state that they're feeling fantastic, but in a low tone, mumbled response while lying in a fetal position. Their thought form. Are their thoughts connected and flowing appropriately? Do they answer questions appropriately? Their thought content. Are they having suicidal thoughts? Are they suffering from paranoia? Are they experiencing obsessions or compulsions? Perception. Are they experiencing hallucinations, be it auditory, visual, tactile? Concentration. Is their memory affected? Do they understand they're having a mental health crisis? Are they orientated and are they concentrating? Is their judgment regarding making sensible decisions regarding their own mental health safety affected? When assessing a patient experiencing a mental health crisis, it's important to assess the risk that the patient potentially poses to the paramedic or others, and also to themselves, either deliberate or accidental self-harm. These assessments, combined with the Glasgow Coma Scale, will give the paramedic a reasonable insight on the patient who is experiencing a mental health crisis and the treatment that they require.